Welcome to Doctors on Call. I'm Jenna Miller. Chronic wounds are a significant burden to the global healthcare systems. With the increase in the aging population, the prevalence and complexity of wounds are only expected to increase. Likely candidates for treatment are those suffering from diabetic ulcers, pressure ulcers, infection, and wounds that haven't healed within 30 days. How are these wounds treated, and how do you take care of a wound after surgery? We'll discuss more of these issues and more on Doctors on Call with our guest, Heather Holaday-Woods from Pawnee Valley Community Hospital.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from
Neighbors, friends.
Our team at Smith County Memorial Hospital is always striving to exceed expectations of our patients and guests. Your family is our family.
Heather Holaday-Woods was born in Great Bend, Kansas, and raised in Garfield, Kansas. She attended high school at Larned High School in Larned, Kansas. After graduating high school, Heather attended Emporia State University, where she received her Bachelor's of Science in Nursing in 2014. She then went on to achieve her Doctorate of Nursing Practice from Fort Hays State University in 2020. Following graduation with her APRN, she completed a fellowship through the University of Kansas at Pawnee Valley Community Hospital. Heather has spent her postgraduate career serving the Larned community. Prior nursing experiences include cardiac ICU, emergency department, acute care, skilled nursing, long-term care, urgent care, and family medicine. Heather is board certified with the American Academy of Nurse Practitioners. Our phone lines are open at 800-337-4788, toll free if you have any questions regarding wound care on today's show. Doctors on Call brings you information which may be useful to you when you see your own physician or nurse. Thank you so much for joining us tonight. We appreciate you coming out.
Yes,
and
course.
Let's get going with with some questions. First of all, what are the most common wounds that you treat in the hospital?
I would say that the most common wounds that we typically treat at Pawnee Valley are diabetic foot ulcers, venous ulcers, arterial ulcers, and pressure ulcers.
Sure. Now, how severe can those get?
Very severe, to the point where they're even life-threatening or limb-threatening. So it is vital to get these wounds addressed rapidly so that we can obviously prevent or hopefully help minimize complications that can occur with them.
Sure. Sometimes you'll hear of the pressure wounds that they'll even go so far as to the bone. What does a person do if that happens?
Absolutely. So usually when it's on the bone, people actually don't necessarily know. They've actually lost that sensation of being able to feel. So we hopefully get it before that, but if we don't, typically if bone is exposed and we're not sure how long, there is definitely imaging or testing that we do. With a bone exposed, you run the risk of having a bone infection, which then can become septic rather quickly. So we typically like to get those treatments initiated very rapidly. So if that is the case, we definitely would recommend that you expedite care as quickly as possible if you notice that on yourself or your loved one.
Sure. And who might be at risk for pressure sore or wound?
So those that are like disabled, paraplegics, your elderly patients that are less mobile, those are typically the ones that we see. Nursing home patients can be those type of patients. However, even patients that use medical devices such as walking boots or things like that, even if you just have a simple device or anything that you lay on or rub on constantly, it can cause pressure. It doesn't take long, only a few hours before you start to cause like a deep tissue injury. So that's kind of the start of a pressure injury. So we typically see them all different ways, from all different etiologies, but primarily I would say those that are bedridden or have lack of mobility or impaired mobility.
Sure. What is a chronic wound?
So a chronic wound is actually characterized as anything past about 30 days. However, it can also be if a wound becomes stagnant. And so I would say if there's a physiological change that prevents the wound from being able to heal naturally, then it would become a chronic wound.
Sure. And what can be causes of delayed wound healing?
Anything from diabetic, if their diabetes is unmanaged, sometimes blood sugars, if they are running very high, that can cause delayed wound healing. Continued pressure, not being able to eliminate that pressure will definitely cause a wound to become chronic, to not heal. A lack of blood flow, a lack of blood supply, improper nutrition is something that we see as well. So there are a lot of different reasons why these wounds can stay chronic and why they have a hard time healing.
Sure. And how do you make an assessment of a wound?
So we initially bring them in. We usually get a referral, or patients can even self-refer. We usually bring them in. We get the full past medical history. We get a good HPI of what happened, how long they've had the wound, what treatments that they've tried. We also go through their medication list, and then we will take pictures if the patient consents, just to track the weekly progress. And then we measure 3 different measurements. Typically we do length, width, and depth. And then we also look and see if there's any tunneling, undermining. Undermining is like a void underneath the tissue where the base of the wound bed is actually larger than the opening is. So those are things that we characteristically look at. We look at the drainage. We look at how much granulation tissue, how much good tissue is involved. So those all are different pieces of our assessments.
Sure. And what is an arterial wound?
So arterial wounds actually develop typically mostly from trauma or some sort of pressure, but the reason that it is an arterial wound is because there's typically a lack of blood supply in the artery or a blockage of some sort that prevents inadequate blood flow to that wound, which enables it to be from healing.
Sure. And how important is wound cleaning?
It's extremely important. Wounds that are not cleansed thoroughly, that are not properly managed, they develop exudate, non-viable tissue, and it delays the wound healing.
Sure. And if a person maybe gets a wound somehow, when is a good indication that they need to get to the hospital?
So I would say most commonly we look at if the wound looks infected. So some of the signs and symptoms of infection would be, if you have flu-like symptoms like fever, chills, body aches, any purulent or green, yellow drainage, discharge, anything that's odorous, anything that is pretty deep, or you're not even sure how it came about.
Okay, we are going to go to the phone lines. We've got a caller waiting to ask a question. This is Carol on the line from Hayes. Hi, Carol. Go ahead with your question for our guest tonight.
Hi, I was wondering what your opinion is on the benefits of Medi-Honey ointment for healing.
So Medi-Honey is actually therapeutic, 100% grade, medical grade honey, and it actually has added benefits of anti-inflammatory properties and also antibacterial. It doesn't actually treat infection, but it does help prevent infection. It's really good to help moisturize a wound bed to try to help stimulate that good moisture balance. I often use it actually quite a bit. It's not a super expensive product. It's pretty readily available, and it's pretty easy to apply, so patients don't typically struggle with it. So I do think that it's definitely a product that is underrated and is very beneficial for wounds.
Excellent. And how does that compare to triple antibiotic ointment?
So triple antibiotic ointment is actually does treat the bacteria. However, there's really no added benefit to treating a wound with antibiotic ointment or over-the-counter like Neosporin or anything. The only thing that really does is sometimes can help with, it's called bioburden or biofilm. It's a complex layer over a wound that is typically only disrupted by like sharp debridement like we do in wound care. But typically I would say Medi-Honey is, you can order it off of places like Amazon. You can get it over the counter. But I would just caution people on doing that, making sure that it is actually the medical grade honey. But I would say depending on the wound, it is superior to even like a triple antibiotic or anything like that.
Okay, very interesting question. Is it better to cover a wound or to leave it open?
100% cover it. They used to say that you would want to leave a wound open, let it scab over. We've actually done research, and research shows that a wound actually heals 40% faster if it's left covered rather than if it's left open to air.
Okay, and how often should the dressings be changed?
So it's very dependent upon the wound. We look at how much moisture is in the wound, how much the wound is draining. We also look at product availability and if the patient's able to afford the product, if insurance will cover it. So it really does depend. Typically, we say no more than daily. They used to do dressings a couple times a day or even daily, and we try to avoid that because it actually, every time that you open and expose that wound to air, it decreases or it stops the healing. So it takes several hours for that wound bed to get to back to a healing environment. So the less time that we can spend disrupting that, the better. So I would say on average, I normally do every other day, trying to push it to maybe every 3 days.
Sure. And how do you select the appropriate dressing?
Again, just based on the type of wound that it is, how dry the wound bed appears, how much moisture is involved. We look at the surrounding skin. If the skin is macerated, which is kind of like if you imagine if you're like soaking your fingers in a tub and they become white and pruny, that's kind of what a maceration looks like. So if there is maceration around the skin, we typically like a product that is more absorbs more. So that's kind of how we gauge basically on the type of wound, how much it's draining, the location, the complexity of if the loved one or the patient can change it themselves or if they have a facility nearby that can help them change it.
Sure. Okay. I wanted to go back for a minute to Carol's question. I find it very fascinating. I wanted to clarify with the Meta honey that it is different than the honey, let's say, that we eat.
Absolutely.
Okay.
I strongly discourage anyone from trying it. But yes, no, honey itself, regular honey obviously has benefits, but I would say that the Meta honey is the actual medical grade honey that should be inside of an actual wound bed.
Okay, so it's not sweet.
I have never tried it,
Okay.
but I imagine it probably would be.
Okay, great. Okay, so let's talk a little bit more about other ointments that are good for open wounds as well.
So we typically steer clear, actually, of a lot of ointments. We do have some. There's one that's called Silvasorb. It actually has a silver component, which is another, doesn't treat infection, but it can prevent infection. It also adds moisture. Not a lot of over-the-counter ointments do I necessarily suggest. The only one that I would say is Desitin. So not a lot of people think about that, but that's that baby butt cream. And that can actually be put around the wound if you do have any maceration or a wound that is draining heavily. And that prevents the good tissue, the surrounding tissue, from breaking down and the wound getting even larger. So I would say most of the ointments that are prescribed are typically from a provider that I would recommend for the actual wound bed itself.
Sure. And why do you not suggest using a lot of ointments?
There just hasn't been a research that has shown that they've made any improvement. Sometimes the different types of ointments can actually be harmful to and delay even further the healing of the wounds. So I would caution against it. Growing up, we always heard, put a little bit of Neosporin or triple antibiotic on it. It's not going to hurt if it's pretty superficial. It's just not necessarily needed.
Sure. And can it actually delay the healing?
It can in certain instances, especially if you're applying it for a prolonged periods. There can become resistance, bacterial resistance, and like I said, it can just delay, the actual granulation tissue and healing phases that need to be happen.
Sure. And are tissue biopsies needed if a wound is failing to heal?
Not necessarily. There are a few wounds that we sometimes will send out to like rheumatology, but typically, no, we don't do a whole lot of biopsies. If I have something that's concerning for the surrounding skin or the margin of the wound, I typically will send them off to dermatology, just so a specialized eye in that field can look at it and make a recommendation. But typically, no biopsies. I don't necessarily do, but I would say definitely tissue cultures.
Mm-hmm. Okay, and what's the difference?
So a tissue culture is actually something that we will take our sharp instrument, our curette or scalpel, and we will get a piece of the tissue, and then we can send that off, and they grow it out in a lab, put it on an agar plate, and grow and see if there's any bacteria or any burden there that's actually contaminating the tissue. So that is something that we utilize very often. However, the biopsy would be more to look at the pathology of the wound and if there's any other characteristics on why it wouldn't be healing.
Sure. And are there different types of wound healing?
Absolutely. So I would say that the different types of, so there's primary wound healing and then there's secondary wound healing. So primary wound healing would be like you went out and you got a cut or a scrape or you got a laceration. Primary healing is through sutures, staples, things like that. Secondary healing is where usually I come in and we heal the wound using different, like the sharp debridement, a device called a wound vac. It's a negative pressure therapy that we use. So those are more secondary healing. That's more commonly what we see in my field than the primary. However, I do look at some primary. I just don't use them as often, but there are different wound healing types.
Sure. And are there ways to speed up the wound healing?
Absolutely. So following the recommendations that the provider makes as far as depending on the location, like I said, if you can eliminate pressure, if you can wear compression stockings for certain wounds, adequate dressing changes, making sure that you come to weekly appointments. The sharp debridement actually is standard of care for wound care. That's where we take that rounded scalpel. We scrape out the wound. It sounds traumatizing, but we put on 4% topical lidocaine, so most of my patients don't even know that I'm doing anything. And then we get rid of all that dead tissue, which if you think about it, it sounds counterintuitive. We make the wound a little bit bigger, but actually, in reality, what we're doing is stimulating that wound, making it bleed, causing those the chronic wound to go to more of an acute wound, the bleeding, the clotting, and then the healing cascade starts.
Sure. Now, at what point can a person take off their bandage after surgery?
I would say I would leave that up to the surgeon. Surgeons operate very differently than what wound care providers do. So I usually just say recommend whenever the surgeon recommends that you could take it off.
Sure. And after surgery, what do you suggest for a person to keep that wound as clean as possible?
So just keeping an eye on it mostly, just making sure that the wound, the edges are what we call approximated, which they're well together, making sure that there's no abnormal drainage. And if there is, making sure that you relay that to your surgeon. I would say keeping it clean. If you can't, if it's advised not to keep it covered, making sure that you do wash it with just some mild soap and water. Don't soak in a tub or anything like that. And then, if you have any questions, for sure, just contact the surgeon.
Sure. And how do you keep a wound as dry as possible?
So I would say we have really cool bandages nowadays. They have a border around them. They're actually silicone, so they're very gentle on the skin. And they are what we would call water resistant, not waterproof. So you can typically shower with them. You just don't soak in a tub with them. So they have come a long way in making it to where patients can live their day-to-day lives and not have to worry about getting used dressing sweat. To keep them dry, though, some are stubborn, and we do recommend that they have like cashew covers that you can buy usually at like a local pharmacy or Walgreens, and you can put the actual boot cover on and keep it dry that way. You can, I guess, do the old trash bag and wrap it up. So those would be the ways that I would say you could keep it most dry. The biggest key is to keep the dressing intact, not allow that dressing to be contaminated while we're trying to heal it.
Sure. And what might be a cause for a surgical incision to reopen?
I would say age is a big factor. We don't heal as well the more mature we become. So age can definitely play a part. Obesity can definitely play a part. Not following the restrictions set for you by your surgeon can play a part. And then I would say location, if it's over a joint space, anything like that. Also, back to being diabetic, if your blood sugars are not well controlled, or even if they are, just sometimes they have delayed healing, or if there's inadequate blood flow to the area, unfortunately, that just kind of sometimes sets them up for that.
Sure. And what is the treatment if that happens?
So it depends. Typically, I would say contact your surgeon, and they will guide you on if the wound does dehisce or comes apart. They usually will guide you. Some will want to see you back in office. Some will want to do what we call a revision of the incision. Some will actually just write wound care orders. They'll have you go and get dressing changes done or see me, and I actually will continue care and manage it until it's healed.
Sure. And if you incur an injury, how do you know when an injury needs stitches?
So I would say if it's persistently bleeding, if the bleeding is not easily stopped, that's one sign. If there's any exposed structures, bone, tendon, or if I would say the mechanism of injury, how deep it goes, how irregular the suture or the laceration is. If you have any questions, though, I wouldn't hesitate to reach out to your primary or go ahead and get it looked at, because if it's not closed, within a decent amount of time, then it does delay healing.
Sure. And how long do you have before it's too late to stitch?
I would say definitely no longer than 24 hours. Usually the quicker the better that you can get in. The longer than that wound is open, that hasn't been properly cleansed, the more likely that you run the risk of having a secondary infection. But for the most part, I would say definitely nothing over 24 hours.
Sure. What is hyperbaric oxygen therapy, and do you guys offer it at your clinic?
So hyperbaric treatment is actually where they offer these chambers. They have acrylic coverings. They stick patients in them, and they lower the atmospheric pressure. And so what that allows is for a very large amount of oxygen to get to the tissues, whereas at normal sea level, that would not be the case. We can perfuse at 100% oxygen, but you have so much hemoglobin in your body that allows oxygen to bind to it, whereas if you're in the hyperbaric chamber, we can actually attach the oxygen to the hemoglobin, but then there's also spare oxygen to be available to the wounds. So what that does is delivers high oxygenation to the wounds, and then it can actually cause regeneration of blood flow, new capillaries and things like that. So it definitely helps expedite those wounds, diabetic foot ulcers with the osteomyelitis or the bone infection. So that is something that is readily available. It's not readily available. I would say that there are centers around the area that have them. Pawnee Valley does not have a hyperbaric chamber, but we are a partner with Hayes Medical Center, and they do have hyperbarics where they do that daily. So other facilities, I would say that I know off the top of my head that offer hyperbarics would be University of Kansas, Kansas City area, Topeka, Wichita. I think Newton now has some. There's probably maybe others, but those are the places that typically have those hyperbaric. Usually a bigger facility will have a hyperbaric chamber.
And is it just for wound healing, or can it be used for other injuries?
It can be used for crush injuries. It can be used for patients that have had delayed healing related to radiation injuries. But primarily we see it mostly in our region, in our area, to treat those diabetic foot ulcers that are just chronic, have the osteomyelitis, and just don't have enough oxygen to the wound itself.
Sure. We have just a little bit of time left. Let's talk about healing foods that can help with wound healing or can make a person feel better.
So I would say a diet high in protein. Protein is necessary for wound healing. Typically, if you do have drainage from a wound, it is protein rich. And so you really need to restore the protein. So high protein, there are also supplements out there that offer, higher protein contents. There's also supplements such as arginate and Juven, and those are really vital too for wound healing. But I would say for the most part, just a healthy diet is gonna definitely play a part in wound healing for sure.
Excellent. All right. Well, thank you so much for being our guest tonight on Doctors on Call.
Absolutely. Thank you for having me.
Absolutely. That is Heather Holaday-Woods from Pawnee Valley Community Hospital. On our next Doctors on Call, we'll be visiting with High Plains Mental Health. You can email questions to us for that next program, doctors@shptv.org. Thank you for joining us for Doctors on Call. I'm Jenna Miller.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from
Russell Regional Hospital, experts, neighbors, friends.
Our team at Smith County Memorial Hospital is always striving to exceed expectations of our patients and guests. Your family is our family.